Good evening. Questions remain about the Ford government's plan to move people in hospital to long-term care homes not of their choosing. The government insists they won't be physically forced, but advocates fear they will be financially forced, and that it has already been happening.
You know, we get hundreds of calls every year on these issues. For the last 10 years, hospital discharge and these kinds of threats and ultimatums made by hospitals have been the number one issue that we've dealt with on the.
According to the provincial government, there are close to 2,000 people currently in hospital waiting for a long-term care bed, and the wait list can last months. Currently, they can be charged the equivalent of the daily rate for a long-term care home until the place they have chosen is available. But now, under new legislation, the government is giving health officials the power to choose a long-term care home for them, even if it's out of their community and one they don't want. Jane Meadis with the Advocacy Centre for the Elderly says if a patient turns it down, the hospitals can then charge an exorbitant daily fee.
They are now going to discharge you on paper, and usually they can't actually send you anywhere because you're too ill, and they are going to charge you the uninsured rate, which is like $1,500 a day. It depends upon the hospital. But this is a game changer because now someone else is going to be choosing that. And I think that the hospitals are going to be very aggressively using that tactic to ensure that people consent, and I don't think it's really consent, but consent to going to these homes that they haven't chosen.
Yesterday, the Minister of Long-Term Care insisted charging a patient a daily fee was not in the bill, but acknowledged it has been an option for decades.
You would anticipate it happening more, though, because you obviously do need to get people out of hospital and into long-term care.
No, look, again, I think that's you're trying to go in a direction that this bill does not put us in.
The opposition disagrees.
This is the government that's saying it's going to clean out all these patients from the hospitals, clean them out. So what are they going to do? Not give them popsicles on Wednesday? I mean, they are going to put tremendous pressure on them to get them out.
Currently, about 24% of patients in hospital beds actually require a different form of care, like long-term care, which creates a backlog of patients and contributes to hallway medicine.
We're taking away people's right to choice.
Dr. Amit Arya works in a hospital and a Toronto long-term care home.
What is the answer here?
We can ask people to broaden out their choices when they're waiting in hospital. I don't know why the government's announcement doesn't call for more investment into palliative care options.
Dr. Arya also notes the average life expectancy of someone admitted to long-term care is 18 months, which means for many it is much shorter.
If we expanded even home-based palliative care options, there may be some people who would be willing to take their loved ones home with proper supports.
Now, yesterday I asked the government how many hospitals have been charging patients higher fees for not leaving and going to a long-term care home. Today, they told me to ask the Ontario Hospital Association, which I have done. I'm still waiting for the data from them.